he was such a great kid. People who don't like kids loved him. You know what? People that couldn't stand to be around kids loved him. He was fabulous.
What happened to Nathan shouldn't have happened. There was a treatment, and that they should have known.
Increasing numbers of young children across America today are potential victims of a mysterious, newly recognized disease. If undetected or treated too late, the consequences can be lifelong or even fatal. Kawasaki disease has brought anguish and uncertainty to thousands of American families.
I came right to the emergency room, and he had already been admitted up through, and so it was that quick. And all those things were just kind of racing through my mind about how serious his condition was, and we didn't know very much about it.
Parents have been forced to become advocates for their children in the ultimate test of love and resolve.
By that point, Nolan was, I would say, in a lot of pain. He was 18 months old, so he had been walking for, at least a half a year or so. And he was kind of hobbling, and he looked in pain, and he was sad. And his feet and hands were so puffy, they were like little sausages, his toes and fingers. And in the course of that 5th day, you could just see in the course of all 5 days, I could see declining health.
And tragedies that could have been avoided have instead devastated whole families.
The paramedics showed up, and I remember sitting on the edge of the bed while they were working on him. I asked her, "Is he okay?" And she said, we're working on him. And I said, "Is he breathing?" And she said, "Well, right now we're breathing for him with the bag." And I said, "Is he alive?" And she said, "We're doing the best that we can," which led me to believe that he wasn't.
In the Red Cross Hospital, Tokyo, in the mid-1960s, pediatrician Tomisaku Kawasaki came to a startling realization. A number of children with unexplained fevers that were resistant to the usual antibiotics were in fact victims of an alarming new disease. The disease presented with a unique set of signs: high fever, red lips, red eyes, strawberry tongue, a bumpy rash, red palms and soles, swollen hands and feet, aching joints, swelling of the glands in the neck, loss of appetite.
1953, the first case I think.
Dr. Kawasaki was ostracized for refusing to accept that these signs merely indicated atypical versions of already described conditions. But one winter night in the early 1960s, he saw a case which proved to him that this disease had not been seen before.
I was waiting in the emergency room one night when a mother holding her baby came running in. The baby was wrapped in layers and layers of blankets. I began to peel them back one by one. As soon as I caught sight of the baby's face, I saw the eyes were red, the lips were red, and the lymph nodes in the neck were so swollen that the baby's head was tilted to one side, with the eye nearly closed. It was unbelievable. I was stunned. The baby's face looked exactly like the face of the first child I'd seen nearly a year before. I immediately looked closer to see his body and found the child had a rash on his belly, red palms, and swollen red feet. This was exactly what I'd seen before. At that moment, I knew this was something very new.
In Japan, every year, there are between 6,000 and 7,000 new cases of Kawasaki disease. In the United States, where the numbers are less certain, it is estimated that the figure is between 5,000 and 10,000 children each year. Theories abound as to what causes Kawasaki disease. Environmental factors such as exposure to freshly cleaned carpets, climatic changes, or genetic predisposition. No one understands how or why children are affected. An elusive infectious agent is suspected as the culprit. We do know that the body responds with inflammation that can damage the blood vessels that supply blood to the child's heart. The resulting weaknesses in these arterial walls can balloon and form aneurysms where clots can build up. This can result in heart attack, possibly even death.
She ended up having a heart attack the day after she was admitted on the 24th of September. She went on to develop large coronary aneurysms to the point where one was 8 millimeters, one was 6, and one was 4.
We did a heart cath and discovered that the right coronary artery was totally blocked.
Treating Kawasaki disease is simple: high doses of gamma globulin and aspirin. But the treatment must be administered soon after onset of the fever in order to prevent permanent damage to the arteries. Tragically, with no diagnostic test yet developed and a general lack of public and healthcare provider awareness of the disease, the diagnosis is often missed.
We took her into the doctor's, and he told us that she had a sinus infection. So he put her on amoxicillin, and that was on a Thursday. On that Sunday then, she developed a rash on her arm, which went away within the day, and continued to have very high fevers that didn't go away. Called the doctor at night, telling him she was running a fever of 104. Told us not to worry about, give her Tylenol. It would take care of itself.
I knew it wasn't just a virus. I had no idea what it was, but I knew it wasn't just a virus.
He said to take some Tylenol and some Motrin intermittently to bring down your fever. And we did that all day. And I called Nana and I said, I think something's wrong with Nolan. And you know what? The pediatricians were reluctant to talk about it.
For Kate Clausen, a rare teenager who contracted the disease, a delayed diagnosis changed her life forever.
I try to have as positive an outlook on this situation as possible. I have aneurysms. I've had 2 minor heart attacks, and 3 years ago was the last one that I had. I've been told that because of the aneurysms, I do have to have bypass surgery, and I think they're looking at double or triple bypass surgery.
Research into Kawasaki disease is focusing on diagnostic tests and identifying genetic predisposition and infectious agents, as well as the historical and environmental circumstances that could combine to cause the disease. This research is, however, shamefully underfunded. But even in the absence of a major breakthrough, we can save lives right now. The Kawasaki Disease Foundation, a parent-based organization, is undertaking a documentary film to increase awareness about Kawasaki disease. The American Heart Association and Children's Hospitals outreach programs contribute to increasing awareness of Kawasaki disease. Support organizations and online connections are allowing parents and healthcare professionals to connect in the ongoing search to share resources, to learn, and to help find a way to combat this disease before it takes the life of another innocent victim.
I just don't want anyone else to lose a child. That's what I hope. It just seems so easily treatable.
My name is Greg Shin. My son Taylor had Kawasaki disease when he was just 3 years old. Fortunately, he was diagnosed and treated in time, so we expect him to lead a full and active life. Unfortunately, for many other children, the outcome has not been as positive. Kids of all ages have suffered heart damage or died because this disease wasn't recognized or treated in time. The message here is painfully clear. We must act now before we lose another child like Nathan Hill. But we can't do this without your help. Your financial support in underwriting this film and other awareness programs will help save precious lives. Awareness can make a difference. It did for my family. Please contact the Kawasaki Disease Foundation to pledge your support. Thank you.